then I can see parents go and then expect it to be done before a prescription can be given. I have parents who say, can you check him for strep before, just to make sure he has it or he doesn't have it. So the question is kind of interesting that they're not asking for a prescription, they're asking me for a test.
Okay, great. And lastly, from this particular product perspective, if I may ask that this particular product would yield a negative result. So would you give so for example, for acute sinusitis, a patient comes on a 5th day and there is a negative result on this test, would you hold the antibiotic or would you go for a culture because since it's the 5th or 6th day, the symptoms are still persisting? What's your take on that? How would it determine your treatment going further?
So I would not. Okay. So a lot of diagnostic test is a guideline. It's kind of to confirm it, but you have to treat the patient right first. You don't treat the results. So I can see this will kind of give me a tool to help me to make my diagnosis, hone my diagnosis, or kind of narrow my diagnosis. But will I withhold treatment just purely on the test result? Probably not.
Okay, so you would not attach much value to the negative result if the patient is clinically not getting
exactly. If the clinically sick, you have to treat the patient. So because sometimes, just like you said, it's sensitivity 90%. That's a 10% chance I might miss something. So you have to kind of still treat the patient.
Okay, and as you said, you do not go routinely for a culture before deciding an antibiotic for an acute sinusitis patient. Am I correct on that?
Yes. Yeah. I can't remember when was the last time I did that. I don't culture sinusitis infection patient at all. We just don't.
Okay. So your clinical judgment basically takes precedence over any lab test in that sense.
Right.
Okay. Great insight. Great insight. We are running to the end of our discussion time. Is it okay if we can extend it for another 5 minutes?
Yes, absolutely.
Okay, great. And just wanted your opinion on the overall antibiotic stewardship program. Are you aware of such programs, and what's your opinion regarding those programs?
The antibiotic what program?
Stewardship program, where the idea is to overall reduce the unnecessary prescription of antibiotics. Do you have any idea about that?
Yep.
Yeah.
So basically, it's an awareness and kind of, it's the same thing that responding to the increase in the frivolous antibiotic use as well as resistant patterns that occur in the U.S. today.
Okay. And how would you believe these programs and advocacy around them impact the diagnosis and treatment paradigm of these two diseases, and where do you see the point-of-care testing device such as ours fit in that particular domain?
I think the device, the what you have, will help to contribute into the awareness and the accuracy of the diagnosis, and it may lead to the decrease of using the antibiotic unnecessarily, and it will help with the resistant emergence of the resistant bacteria.
Okay, and from an applicability perspective of antibiotic stewardship program, in which kind of a clinical setting, say a hospital, a tertiary care, or a primary care physician, or an emergency room, where do you believe that products such as ours have greater applicability because of antibiotic stewardship program?
Okay. I mean, so I guess all of them, because, patients don't access one point of care. They have access to treatment in multiple facets, right? It's in the ER, it's in the hospital, it's through the clinics, it's through medical groups like mine. So if you want the biggest bang for your buck, I believe it's going to be through the primary care offices, because the ED, of course, they come in when they're deadly ill or when they can't have access to the primary care offices. So primary care offices in the ambulatory setting is still the gatekeeper. We're the first contact point, because we see them when they're sick, we see them when they're well, we see them when they're born, we see them when they're injured, we see them when they're sad. I mean, they come in to access care through us for so many other reasons that I think the ambulatory setting is still the ideal setting to launch these kind of a preventive or diagnostic tool, because we're the ones who see them the most.